Okay, so the assessment for the eyes and ears, I'm going to start with the ears. So first we would just look at the exterior. So we would look for any lesions, inflammation, like the overall color and like just the texture. And then we'll look, we're going to palpate the mastoid process and then the pinna and then the tragus and just see if they have, or the tragus would be there, and just see if they have any tenderness while we're palpating them. And then to look inside, we would need an otoscope, which is a viewing window with an attachable light that lets you see the interior of it. And then some tests. So like we would just go in and look, and then we're looking for color in there too. And then tests that we'll do. The first test is the Weber test, and you take a tuning fork and you hit the you hit the tunes of them, and then you would put the base at the midline of the patient's head, and then it should be an equal distribution of the sound should be heard. And then another test is the whisper test, which we would just have the patient cover one side of the ear, and we'd go over and whisper something. And for that, if you're saying 6 like letters whispering, they should get at least 3 back, would be a normal finding. And then the Rhine test, which again is the tuning fork, but this time it would go on the mastoid process, and then you would have the patient say now for when they stop feeling the vibration for that. So that's the test for the ears. And then onto the eyes. First, external, we're looking at the eyebrows, the eyelashes, the sclera, the conjunctiva, and then pupil, iris. Like we're just looking at that for the outside. And then normal findings we're inspecting the eyelids. The eyelid should open and close regularly, and there should be no problem with that or any fluid leakage. And then we're inspecting the eyebrows, just that they're symmetrical and there's an even distribution of hair on each one. And then to inspect the conjunctiva, we would have the patient put their eye up and then look down. And so we're doing that. And then the sclera should be white, and we shouldn't see any other colors going on in there. And then the pupil, and one of the tests is like you would cover the eye, and then you're looking, and then when you uncover, it should be staring straight ahead. And that's the, what test was that? That was not the cover test, but the cornea light reflex test. And then the cover test we did, and then the Snellen chart is used to like describe if you have farsightedness, nearsightedness, and you just have the patient read back the numbers that you're giving to them.